Thank you everybody for joining the Breast Cancer Resource Center and our virtual education series. Today we have Dr. Angela Wicker-Ramos with us, speaking about exercise during and after breast cancer treatment. We're so excited to have her. Angela is a oncology, physical therapy, lymphedema treatment, and pelvic floor rehab. So I'm gonna go ahead and turn it over to Angela.
Hi everyone, thanks for joining today. I would like to talk specifically about exercise during and after cancer treatment, the benefits of exercise, why you'd want to do it, and then especially right now when people are stuck at home, or let's say you're undergoing chemotherapy and your blood cell count's low and it may not be very safe for you to go out to a gym. I want to come up with some creative ways for you to exercise at home, because we know exercise is important, but you don't always have the ability to go out and do it in a group. So let's make sure you have some other options as well. So like Elizabeth said, my name is Angela, and I have been an oncology physical therapist and a certified lymphedema therapist for over 12 years now, almost 13. And my passion and what I do is help people move beyond their cancer treatment to help reduce the side effects of cancer treatment through movement and through exercise. So let's get started. And I'm the owner of Cancer Rehab and Integrative Medicine, which is a multidisciplinary wellness clinic for those surviving and thriving from cancer treatment. So let's talk about exercise during and after treatment. This can be appropriate for someone who is actively receiving treatment, as well as after their treatment, let's say immediately after to years afterwards, or for those who are on cancer treatment for the rest of their lives. This information will be important for everybody at any stage in their treatment. So the first 3 slides, what we're going to really look at is these are things that exercise can help with. So as you look at these next 3 slides, I want you to think about, am I experiencing any of these things? Will I benefit from an exercise program looking at these things? And I bet you almost every single one of these things is appropriate for you because these are common side effects from cancer treatment. Fatigue. Almost everybody, the research states about 80% of people report fatigue during cancer treatment. Same percentage with depression and anxiety. It's situational. It doesn't mean that you're dealing with depression and anxiety long term, but it's absolutely appropriate and common to be experiencing some mood issues such as depression and anxiety when you are dealing with the diagnosis of cancer. Mobility issues, changes in the way you move, changes in your endurance, your strength, your balance. Weight changes. Weight changes could be either you've lost a lot of weight because you're having GI issues, or you've lost a lot of muscle mass, or weight issues, let's say that you are on endocrine therapy. So you're on something such as an aromatase inhibitor or tamoxifen that's making it hard for you to lose weight. Bone density issues. A lot of different types of cancer treatment can impact your bone density. Circulation. Exercise can help with circulation, both lymphatic circulation and blood circulation. Joint pain. Joint pain is very common as a side effect of those aromatase inhibitors and that tamoxifen, along with some chemotherapy agents as well. Balance issues. Balance changes can be from weakness. It can also be from vision changes from chemotherapy. It can also be an issue with neuropathy, numbness and tingling in the feet. That changes the way you experience your balance. So increased risk for falls, more difficulty with your daily activities. Self-esteem and sex drive issues. And then this last slide, most important slide when it comes to the benefits of exercise, quality of life, improved quality of life. There's a robust amount of research demonstrating that consistent exercise during treatment and after treatment improves overall quality of life. Newer research is demonstrating it's improving efficacy of the treatment itself. So exercising while you're getting radiation treatment and while you're getting chemotherapy treatment can help improve the efficacy of that treatment. Survival rate. Exercising during treatment increases your survival rate, how long you are going to survive. And then recurrence, significant decrease in percentage of recurrence rate. with regular exercise. And we are going to go over specific research studies and specific types of exercise for almost all of these specifically. And then immune function. We know that exercise improves your immunity, which is very important right now as well, but is important during any time during your treatment, and then even after treatment to reduce your risk of getting sick. Exercise improves that, your body's immune function. So we're going to speak to the recommendations for exercise programs and what the research says. However, I don't want you to be overwhelmed if you have not exercised before, or it has been a long time since you've exercised. Let's say you got that cancer diagnosis and you have not returned to an exercise program since. These recommendations that I'm going to give you today are your ultimate goals. They're what you're going to be moving towards with the information that you're going to get. However, know that any increased mobility, any increased movement, any increased physical activity you do will positively impact your recovery and will help reduce your side effects. So you don't have to be going from no exercise to doing 150 minutes of exercise per week in order to have the benefits that we're discussing. Every little bit will help you. So it's not all or nothing is basically what I'm saying. So if you haven't exercised in an extended period of time, doing something as simple as going from sit to stand multiple times is improving your physical activity. Or if you haven't ever done a walking program, doing a small 10-minute walking program a couple of times per day will be beneficial. So find the type of exercise or even just the type of movement that feels right for you, that's pain-free, that feels good, and start with that. Always have to preface by saying when you're going to start an exercise program, do consult with your medical oncologist or your healthcare team to make sure that you are ready physiologically to get into an exercise program. And also know that with everything we're going to go over today in this presentation, if you don't feel ready to dive into an exercise program and you need help getting into that, know that there are physical therapists that specialize in oncology rehab that can help assess and create an individualized program for you to get you safely into an exercise program. So general exercise guidelines are 150 minutes of moderate intensity exercise per week. And that 150 minutes, what research has stated, it doesn't matter how you divide that up during your week. The benefits are still there. So if you do 22 minutes daily or you do a big chunk of 50 minutes 3 times per week, you're getting those benefits. So remember in the previous slide, I said, if you haven't gotten into a walking program, you can start with 10 minutes. You can do 2 sets of 10-minute walks, and you're almost at that 22 minutes in a day, okay? And when we're talking about physical activity, it doesn't just have to be what you would consider a traditional gym program. Brisk walking and stationary bike, but things like dancing, or organizing or cleaning your room, mopping the floor, carrying your groceries in, mowing the lawn, all of those things have the benefits of an exercise program or improved physical activity. So I just mentioned 150 minutes of moderate intensity exercise. What does moderate intensity mean? Moderate intensity means that you can talk through your exercise program. So let's say you're walking with a friend. Walking, you can talk through your walking program, but it's going to be pretty hard for you to sing a song. That means you are pushing yourself to moderate intensity. You can talk through it. You're not so short of breath that you can't, but it's going to be hard for you to sing a song. Moderate intensity exercise, that's the simplest way to define that. All right, so in terms of strengthening exercises include weights, they include resistance bands, things like that to help you improve your muscle tone. And the minimum amount of times per week to really significantly get a good strength gain is 2 times per week with the strengthening program. And for the oncology population, or for people who have dealt with cancer treatment or are in cancer treatment, and also the population that may be at risk for lymphedema because they've had injury to their lymph nodes or removal to their lymph nodes, the recommendation when it comes to weight training or strength training is to increase your reps and your sets before the intensity. So what that means is, let's say you start with 6 repetitions, just one set of 6 bicep curls as an example. And then you increase to 2 sets of 6. Then you increase to 3 sets of 6, still using the smallest weight, 1 pound. Then you increase to, let's say, 8 repetitions, 2 sets of 8, 3 sets of 8. Then you're ready to increase your weight. So the very last thing you progress with is your weight. That is the safest way and the kindest way on your body to progress with a strength training exercise program. Now, right now, many people are at home and don't have free weights or don't have resistance bands. And so what can you use for weights? There's a lot of creative things you can do here. 1 can of soup is about 1 pound. And then if you go to your family size soup, that's about 2 pounds. A bottle of ketchup is about 1 pound as well. And one great way you can kind of change up the weight as you go along is actually to use a water bottle. And you can either put water in it, progressively increasing the amount of water in it, or you can use something like sand or dirt or rocks to increase your weight incrementally. Another thing you can do are bags of coffee or rice. Small bags are best because you can grip them easily, especially if you're dealing with neuropathy in the hands. Milk, different types of containers. So obviously you would work your way up to a gallon of milk. That would not be your starting point. However, knowing that a quart is a little more than 2 pounds and a half a gallon of milk is about 4.3. And then obviously a gallon is working its way up to a little over 8.5 pounds. A jug of laundry soap is generally about 3.75 or 3.75 pounds. And then even olive oil, things like that, weigh about 4 pounds if you're looking at a 2-liter bottle. So just a way, I just want to get your brain going in a creative way of, oh, what do I have in the house that I can use to progress my exercises? So we talked about strength training should be at least 2 times per week, ideally 3, but at least 2 in order to increase your strength. Now let's talk about stretching. So stretching is very important during cancer treatment and after cancer treatment for a couple of reasons. The first reason is specifically because of scar tissue. Scar tissue, when you've had surgery, is a very different type of tissue than before your surgery. It has a lot less elasticity, a lot less give or stretch. And then the same thing with tissue that's had radiation to it. That tissue is very dehydrated. It definitely doesn't have that same elastic quality. And radiation has been known to be called the gift that keeps on giving, meaning the tissue that has had radiation will continue to want to tighten for a very extended period of time. We're talking about months to years. And so a stretching program in this particular situation where you've had surgery, so now you have scars, or you have had radiation, you need to be stretching every single day to change that tissue quality. And with that stretching, you need to hold that stretch for a little longer in that area that you've had your treatment, a little bit longer than you would normally hold a stretch. And that's because that tissue quality, that tissue is a lot more like a net. It's a lot tighter, less elasticity to it. And so you want to hold it for 30 to 60 seconds, 3 times. So that's 3 repetitions, 30 to 60 seconds each. That's a long hold, right? And you want it to only be a mild to moderate intensity with that stretch. So it's not aggressive. It is a long, sustained, light to moderate stretch every single day. Here are some examples specifically for people who have had breast cancer treatment, just in ways to stretch the front of your chest, to stretch your armpit area. And this one is using a broom handle or a dowel right? So these are just some examples to show you how to get creative. With every stretch you do, it should not be painful. If it's painful, you need to back off of it or not do that particular stretch, okay? And here's some examples of doorway stretches. This specifically gets the muscles in the front of the chest. You have that lower stretch. You have a stretch that's about 90 degrees to the floor, kind of like a goalpost. And then you have a stretch with the arm more overhead. Make sure that you get clearance from your surgeon before you start a stretching program. You want that area to be healed, which is usually about 4 weeks after your surgery before you start doing any aggressive stretching. But being gentle, doing it within a pain-free motion, you can do within 2 weeks, but definitely get your surgeon's clearance. And these stretches, let's say that you had your cancer treatment and finished your cancer treatment a year ago and you didn't know about these stretches and you didn't do them. That's okay. Now is the time to start, okay? It's not too late to start a stretching program and to loosen up scar tissue and loosen up areas of tightness from radiation treatment. Exercise is profound in decreasing risk of recurrence and improving survival rate. In this particular study, they looked at women who were breast cancer survivors who walked 3 to 5 hours per week, just at that moderate intensity pace. And they found a 40% to 50% lower risk of breast cancer recurrence compared to the group that wasn't doing a regular walking program. That's a pretty significant number, right? I know a lot of you guys are taking aromatase inhibitors and tamoxifen to reduce your recurrence rate similarly. So why not add an exercise program as well? Because that is a very powerful tool to help reduce your risk of recurrence. And then survivorship too. We know that it can improve your survivorship. Why? Now, we don't know 100% for sure why exercise can improve survivorship, but there are some theories here. One is that exercise reduces the amount of hormones that are going through your body that are stimulating tumor growth. And one example would be growth factor 1. However, we know that an exercise program helps reduce those hormones that are stimulating that tumor growth, as well as it activates genes that suppress that tumor growth. Exercise also stimulates appropriate cell death, so cell death of those cells that are those tumor cells. It improves vascularization or helps bring oxygen to the region. So let's say you are undergoing chemotherapy. It helps promote the efficacy of that chemotherapy treatment. It helps that drug delivery. Decreases inflammation. Inflammation is a huge part of many diseases. Exercise reduces inflammation in the body. Even lymphedema, abnormal swelling that can happen from lymph nodes being removed, is inflammatory. So exercise is beneficial for lymphatic health as well. And then improving your immune function, improving the way that your body fights disease. Very important right now, always important. And that happens in many different ways. Exercise improves your immune function in many different ways. But that does include lymphocyte production, which is production of some white blood cells in your body. Next, let's talk about fatigue. I guarantee, and every time I do this presentation, when I ask my audience to raise their hand if they're dealing with fatigue, everybody raises their hand. This is such a common issue. So exercise can absolutely help with fatigue. And I know that this seems very counterintuitive. You're tired. The last thing you want to do is exercise. And, I'll be flat out honest with you. When you first start an exercise program and you're dealing with fatigue, in the very beginning, you may feel more tired. You may not have that reduction in fatigue until you've been exercising consistently for a few weeks. But the research is robust. We know that exercise reduces fatigue if you do it consistently. This particular study that I have cited here looked at 28 individual studies specific to cancer-related fatigue that demonstrated that yes, exercise reduces that fatigue. What type of exercise? Both aerobic exercise and resistance exercise, or those weight training exercises, do reduce your fatigue. Mental health. Remember, we talked about anxiety and depression, not only from cancer treatment, but from other things going on in our lives as well. Exercise significantly reduces anxiety and depression. It does that on many different levels. The first is, probably all of us know, it helps you release endorphins and neurotransmitters that help decrease depression and help improve your mood or boost your mood. But also, it increases your body temperature, which has a calming effect on us. That has a calming effect on our nervous system. Another thing exercise does is, a lot of my patients mention that, from the moment you get diagnosed with cancer, some people feel like they're on a roller coaster. They are no longer in control of a whole lot in their lives, right? Their medical team is telling them what treatment they're going to have next. They're not in control of their side effects or their symptoms. And so this exercise program, your decision to start exercising and how you're going to start exercising is, it's a goal. It's something that you're in control of. So it helps gain confidence. It actually empowers people because it is your decision and you are controlling it and choosing to do it every day. It's a way to take your mind off of your worries. It's hard to be exercising and thinking about something else at the same time. So in a way, it actually is a mind-body practice. It is a way for you to be mindful because you're focusing on your exercising, especially if you're doing something like dancing or something that takes a lot of focus, Tai Chi, Pilates. It's almost impossible for you to be thinking about other things while you're doing that. So it is a great way to take your mind off of worries. And it's a great way to cope in a healthy way versus looking at alcohol or stimulants and things like that. Cognition, chemo brain. Chemo brain is a term that isn't the best or most accurate term when it comes to cognitive deficits or cognitive changes because of cancer treatment. Because we know that, yes, the actual chemotherapy agent does impact your ability to focus and your memory. However, so does a lot of other things in your cancer treatment. Even if you're not undergoing chemotherapy, you're probably not sleeping well. You have anxiety, so you have difficulty focusing. You're fatigued, so you have difficulty focusing. There's many other reasons why people have difficulty with cognition and focus during their cancer treatments. But guess what? Exercise can help with that as well. So with cognition, aerobic exercise has been shown to help with memory deficits and word finding ability issues. And I know these are two things that my patients say quite often are changes that can happen during cancer treatment. Difficulty remembering things, difficulty finding the right words, and aerobic exercise can help with that. Coordination training, what that is things like Pilates, Tai Chi, dance, things that involve thinking about your body, where your body is in space, what your body is doing. Those things can absolutely help with your cognition and your focus, specifically on your body awareness. This study from 2010 was very interesting because it was looking at cognition and resistance exercise or weight training exercise. And in this study, the subjects only did resistance exercise 1 to 2 times per week for a year. So that is that's not a significant amount per week. However, the results were pretty significant. The subjects reported improved complex thinking, improved reasoning, improved multitasking, and improved problem solving. So we know that resistance exercise along with aerobic exercise can be helpful. And then I'll note meditation is not specifically exercise. I do consider it exercise for the brain. And this particular study, they actually did imaging on the brain while people meditated or as people had a regular meditation program. And this regular meditation program was not what you would traditionally think of as a monk meditating for 3 hours every single day doing absolutely nothing. Meditation was, guided meditation practices, coloring in a coloring book, walking, things that just are mindfulness practices. And they found with the imaging the brain that there were actual structural changes with consistent regular meditation in the areas of the brain that are important for cognitive functioning, such as sensory, cognitive, and emotional processing. So meditation, think of it as exercise for your brain. Bone density. Already as we age, our bones become less dense, right? I mean, that just happens naturally through aging. And then you add cancer treatment onto it, not only the cancer treatment itself, but then also the fact that perhaps we're more sedentary, then that makes bone density issues more of a concern. If we have bone density issues, then things like falling can be serious, right? It could lead to fractures. You add bone density issues to also having neuropathy and balance issues that needs to be addressed, and exercise can absolutely help with that. Types of exercise that help with bone density are what we call weight-bearing exercises, which means working against gravity. The way that you stimulate bone growth is by creating some form of impact on that bone, whether it's through something such as walking or hiking or climbing stairs or dancing, so something that really truly has impact, or even weight training. And the reason why weight training can help with bone density is if you imagine your bicep muscle, right? So your bicep muscle attaches up in the shoulder, and then it attaches down in your elbow. And when you contract like you're doing a bicep curl, both the top area and the bottom area get pulled, right? That muscle is pulling on those areas of the bone. That stimulates bone growth as well. So that's why resistance training can help stimulate bone growth. Now, there are non-weight-bearing exercises such as swimming and biking, which are beneficial for many other reasons, but are not the ones that you want to necessarily focus on if you're looking to improve your bone density. And if you're looking to improve your bone density, what's the minimal amount you need to be doing some form of weight-bearing exercise or resistance exercise to help your bone growth? This particular study reported 2 times per week as the minimum amount to help impact bone growth. Heart health. Chemotherapy agents, tamoxifen, Herceptin, all of these things can impact the health of the heart. And so an exercise program is absolutely imperative if you are on these particular types of drugs or particular types of treatments. Now, you need to be, and you would be, carefully monitored by your medical oncologist for your cardiac health. And you wouldn't necessarily be pushing yourself into an intense exercise program, such as a high intensity exercise program. But you do need to be exercising in order to ensure heart health and to help minimize those the heart toxicity that can occur from these treatments. This would be a situation where it would be beneficial to have an oncology certified physical therapist on board to figure out the appropriate intensity for your exercises and to progress you accordingly. Next, let's talk about lymphatic health. So, many years ago, before they started actually researching lymphedema and what increases your risk for lymphedema and what decreases your risk for lymphedema, people would hear statements such as, don't exercise, don't lift weights, that will increase your risk. That was not research-based at all. Now we actually have some research, and what it is stating is that exercise is not only something that is safe for you to do, but it's actually very beneficial to improve your lymphatic health. For people who are at risk for lymphedema, and what lymphedema is an abnormal swelling that can happen in the area where you've had lymph nodes removed or radiation treatments, they found that if you're at risk for lymphedema, exercise or movements can help decrease your risk. And if you have lymphedema, it can help decrease the swelling and help prevent or reduce progression of your lymphedema. So exercise is very important from a lymphatic health standpoint. Now, how you progress your exercise program, this is important. You don't want to create inflammation or create injury in the area where you have lymphedema or you're at risk for lymphedema, meaning you don't want to just dive in and be super aggressive immediately. So if you've never lifted any weights, the recommendation in the area where you are at risk for lymphedema, and for the breast cancer population, that would be the chest or the arm. In those areas, you definitely want to start with no weight and then gradually work your way up in pounds. So start with 1 pound for any sort of arm exercises you're doing, and then go to 2 pounds the following week, and 3 pounds, and then 4 pounds. And there's no limit as to the amount of weight that you can lift as long as you're progressing slowly, because what we want to avoid is injury and inflammation in that area. So as long as the exercise is pain-free and as long as you're progressing gently, you can work your way up to any weight. The stronger you are, the stronger your pumping action of your lymphatics. The main way your lymphatics move fluid through your body is by your muscles contracting and relaxing. So you need a strong muscle pump to move lymphatic fluid. That's why this is so important. Now, how you know that you're perhaps progressing a little too quickly, one way I like to have you kind of monitor that is to say, can I do the same exercise the next day? If you're so sore that you can't do the same exercise the next day, you want to back off. That means you've progressed too quickly. Back off and progress a little bit slower. So we do know that exercise improves your lymphatic circulation 5-fold in the first 15 minutes of exercise. That is really great increase in lymphatic circulation, so very beneficial. Other ways to promote lymphatic health: deep breathing. You have a very large lymphatic vessel that runs up the abdomen area or up the belly area. That's called your thoracic duct. For those people who are local to Austin, I call it I-35. It is the major transportation system for your lymphatics. And that thoracic duct is stimulated when you breathe deeply because of where it's located. It's located in the area kind of up the abdominal area and the trunk. And so when you take deep belly breaths, that stimulates your lymphatic system. So what happens when we exercise? We increase our respiratory rate. We're taking deeper breaths. So that's stimulating your lymphatics as well. But if you do yoga and you do meditation and that's involving deep breathing too, you're also stimulating your lymphatic system that way as well. Trying to decrease your stress as much as possible will help promote a lymphatic system, and staying hydrated as well. All right, so exercise and sleep. Sleep can be problematic during cancer treatment. It can be problematic for anyone at any time. And when you do your exercises and how you do your exercises can impact your sleep, either in a positive way or a negative way. Exercise can promote good sleep. If you're exercising consistently, you will sleep better. However, you do not want to be doing vigorous exercise activity right before you go to bed, right? Because that's going to get you all riled up and you're going to have a hard time falling asleep. So if you want to schedule your vigorous activity in the morning or a little bit towards midday or early evening, that would be most beneficial. What you want to do right before you go to bed is a more gentle, relaxing exercise program, such as yoga, in order to calm your nervous system down and get you ready for bed. Or it would be a great time to do your stretching program. Neuropathy and exercise. So neuropathy is nerve damage that can occur from chemotherapy, can also occur from surgery itself, and it can be defined in many different ways depending on the person. Some people report it's weakness, numbness, tingling, temperature sensitivity, pain, or hypersensitivity. So feeling like you're barely touching that area, but the sensation is really significant. Neuropathy can be an issue, and exercise can help with the side effects or the what happens because of neuropathy. Because of neuropathy, you can experience balance issues, difficulty with your fine motor skills like picking things up, writing, sewing. It can definitely impact your safety. It can impact your posture, your strength. and also your pelvic floor strength as well. So those muscles in the pelvic floor that help you stay continent or help reduce any issues with incontinence or leakage. All of those things can be impacted by nerve damage. So exercise can help all of these things. Exercise can help with gait. So the way you walk, you may notice that when you're dealing with neuropathy, the way you walk changes, which can lead long-term to pain. It can impact fine motor skills, dexterity, coordination, your balance, and again, we mentioned posture and core strength. And so exercise is a way to kind of counteract that. Dancing. Being a dancer myself, it's one of my favorite forms of exercise. And so I loved this study because this study reported that exercising 90 minutes 2 times per week for 6 months, the group that did this reported both memory and balance improvements. So helping with the neuropathy issues, but also with those cognitive issues as well. I understand 90 minutes of dancing is a long time. Remember in the beginning of this presentation, we stated that something is better than nothing. So even shorter amounts of dancing can be beneficial. All right, so hormone or endocrine therapy, that's our tamoxifen, that's our aromatase inhibitors. Those have side effects, which I'm sure you guys are familiar with. And as I read over these side effects, you're gonna realize that we have already talked about these. Bone loss, bone density issues, joint pain and muscle pain, weight gain, fatigue, muscle weakness or muscle loss, and then sexual issues. We had talked about pelvic floor and how weakness of those muscles can definitely impact our sexual function. And what anti-estrogen therapies can do is they actually thin out the tissues of the pelvic floor and weaken those tissues of the pelvic floor, as well as decrease the lubrication in that area as well. And so pelvic floor exercises, or what are known as Kegels, can positively impact that area as well. And so here are the side effects that can occur from those aromatase inhibitors and tamoxifen. And again, exercise can be beneficial with that. So this study in 2015 has been a very exciting study for medical oncologists, because one of the main reasons people stop taking their aromatase inhibitors or stop their medication is because of significant joint pain or muscle pain. And so what this study demonstrated is that 12 months after a consistent exercise program, people reported a 20 to 30% decrease in pain. Now, although 20 to 30% may not seem like a large number, if you are in pain, you will realize that 20 to 30% reduction is significant. And for most people, that's enough of a reduction to keep them on the medication and have the benefits of the medication. So this study is important because before you stop, or before you ask your medical oncologist if stopping this medication is okay, let's get you into an exercise program to see if your joint pain and your muscle pain reduces, because most of the time it does. So we've spoken about different side effects of cancer treatment and how different exercises can help with those side effects. And here is just a particular slide that looked at all of the research, or a lot of the research out there specific to these side effects, and what we found with aerobic exercise, resistance exercise, and a combination. And what you're gonna find is variety is key, right? So variety to the types of exercises that you do is gonna be the most beneficial in helping with all of the side effects that we've mentioned. So most of the time when I do this presentation, I have a list of on-site exercise programs that people can attend. And right now, we know that gyms are not open right now. And so I wanted to give you a different list of resources. And those resources are online exercise classes. And I know there's a lot out there right now, but these resources are specific to ones that are for people undergoing cancer treatment or recovering from cancer treatment. So they're keeping that in mind with these programs. So Cancer Rehab and Integrative Medicine has a place on our page with many different online exercise programs that are completely free. They include Pilates, cardio, yoga, and even some meditation. Memorial Sloan Kettering has a great group of videos for Tai Chi. Remember, we talked about how Tai Chi is a great way for balance, to help with focus, cognitive functioning, and also calming the nervous system down. Yoga for Cancer has a great group of exercise programs. Mass General Cancer Center has a great group of videos as well. And then Yoga with Adrienne is a great resource because it has many different yoga videos specific to different areas of the body or specific to different symptoms. Now, some people, I bet you're watching this and you're thinking, I'm not quite ready to hop into an exercise program without guidance. And so that's a time where actual physical therapy with a specialized physical therapist would be beneficial. And it may be hard to find someone who is oncology specialized and treating right now in the clinic, and it may not be appropriate for you to go in the clinic right now for safety reasons. And so do know that there are some oncology specialized physical therapists out there who are offering telehealth, meaning online physical therapy sessions until it's safe to get back into the clinic. And so just wanted to let you know that that is an option for you. You don't have to wait right now. You can start getting rehab if you need it. And I just wanted to give you my contact information here. Feel free to email me with any questions about any of the information that was presented today. I am absolutely here as a resource for you. And thank you so much.
Wow, thank you so much, Angela, for joining us today again. You see her contact information, and we are super grateful that we had her present with us today.
Thank you.